If you're an OT or PT and you work with finger amputations, this is going to be for you. I just recently got a patient in my clinic that had amputation of his long finger and his ring finger. And I wanted to share some perspectives around treatment and then share some treatment ideas for you. My name is Huang. I'm an occupational therapist and certified hand therapist. Over 10 years ago, I started my therapy clinic, and over 5 years ago, I started Hand Therapy Secrets to share what we do here at the clinic, but also to help therapists develop their clinical skills. So this patient, so my therapist had some questions around this, and this is why I wanted to share this. My patient came in and had a amputation. Love drawing, love drawing. So a patient came in, he had an amputation of the DIP, but it was more than just the amputation. I mean, it like crushed his finger. So he has some soft tissue damage here. And this finger is the worst. But he had an amputation above the DIP, and then the ring finger, it's amputated below the DIP. So I wanted to share a perspective in terms of what we're looking for or what our expectations are after an amputation like that, because that dictates how you're going to treat them. If you don't really understand what you're looking for, then you can constantly be frustrated because your patients are going to be frustrated. They're frustrated that they got this injury. They're frustrated, like, why aren't they moving? But if you can back everything up by anatomy, just understanding the nature of the injury, the nature of the tissue that's remaining, this can help guide your treatment process, right? So, a lot of times when your patients come in after an amputation, what do they have? They have swelling, they have a lot of scarring, and they have a lot of stiffness. And so that overarching aspect can't allow them to be very functional with their hand. So what tends to happen? They are wrapped up for a certain amount of time, right? They have bulky dressing, and so they end up using their fingers like this. Let me know if that's true for you. This is happening for my patient, and this generally can happen for other patients I've had. Now, of course, it depends on the finger, right? If you have an amputation of the small finger, they tend to use it like this, and so the MP can get stuck. If you have an index finger amputation, then they can also do the same because they'll stick it up like this. It's just a nature. Every finger has its personality. You know what I'm saying? But if it's the two smallest finger, two middle fingers, they might start using it more like this because they're trying to get functional with their hand. They're trying to use it a little bit. So let me know if that's happening for you too, because these are some of the patterns that I'm seeing. So one of the things that I told my therapist that I wanted to share with you is, like, you want to think about the anatomy in terms of where the amputation has occurred. So if you think about anatomy, your flexor digitorum profundus, starts in the elbow, passes the wrist, comes to the hand, but it inserts at the base of the distal phalanx. So the profundus is the tendon or the muscle that pulls the DIP down. Secondarily, it pulls the PIP down, and thirdly, it pulls the MP down. So if we think from an anatomy standpoint, it does all that work, right? If they're trying to leave that tendon in, they're not because they're expecting like a ton of motion at the DIP, but if they're trying to leave that profundus there, it's because the profundus secondarily helps to flex the PIP. And it secondarily helps to flex the MP. So when you can leave that tendon there, it's going to help that hand be a little bit stronger, especially at that finger, right? We need this finger. So with my patient, this ring finger was amputated below. So now we're like losing the leverage of that profundus tendon. So now, because that profundus tendon isn't bending at the PIP, this finger tends to be weaker because now you don't have the profundus helping the superficialis bend the PIP. Right? So when you start thinking about the injury in that way, it can help set your expectation on what you're expecting for this patient to be able to achieve. So if we're having, a weaker tendon to bring, of course, there's swelling, scarring, and all that stuff as well that then can help get in the way of how the PIPs are moving, then don't be surprised that your patients are gripping like this versus trying to grip like this. And so if that's the problem, what are we working on? We're working on this. We're working on a straight fist. Even though this finger and this finger, they still work, you're going to encourage them to work more like this. And so that will give you your overarching goal of what you want to work on. You have to manage your expectations. You have to manage your expectations as a therapist because you have to manage your patient's expectations. They don't see this every day. This does not happen to them every day. But if you're working in a hand therapy space, you're seeing hand injuries all the time. And so you have to have a perspective, you have to have a certain expectation of what they're able to achieve. Let me know if that makes sense. So if you can manage your expectations on what they're able to achieve, then you can help them manage their expectations because no one wants to get injured and everyone wants to get better yesterday. So my point being is y'all people frustrated for no reason. We have to do the therapy is the repetitiveness of it, which is what helps us to get better. So now that we understand, like, hey, the PIPs, they are, they can get really stiff because the tendons aren't moving them as well, right? So number one, that's a problem, range of motion, functional grip. Number two is there's a lot of swelling, scarring, and it can get in the way of being able to move. And what happens with that is, there's a bulkiness to the dressing. So you have to make sure that we are promoting wound healing so we can debulk that wound because we don't want them gripping like this. It becomes very dysfunctional and becomes a habit. So as fast as you can, you want to make sure that the dressing gets smaller and smaller to nothing, because if you don't have touch, then you become hypersensitive and then you can't use your hand because you're so hypersensitive to the touch. So we have to get really comfortable using our skin, essentially, you're basically new nerve endings that then connect to your brain, right? So people always ask me about the shaping of the stump, the swelling, and things like that. So let me show you exactly what I do. So you're going to do this for your patients, right? Now, that when someone has a graft to their finger and because of the amputation, sometimes they'll kind of like have a wound that is across and is doggy-eared. So their wounds kind of like stick out, right? And we want to be able to soften that off and round that over, right? And it's, the shape is the shape, but what we're shaping or what we're like minimizing is the swelling, but also softening that scar so we don't have like little doggy ear endings on the ends of our fingers. So the way I like to do them is with Coban, right? So here, let me show you on my hand. Right? So let me show you here on this finger. So normally here's the nail and you would think, oh, I'm going to go and I'm going to fold it across and then we're going to bandage it around, right? We're going to go around so that you can cover the tip. So part of it is like the patient wants to have it covered. You also want to have it covered to a certain extent to kind of help with the edema and the scar. Well, when you do that, you kind of promote that doggy ear. So one way to kind of round that off is just move the Coban. So instead of starting from the nail base, you start off from the side and then you go around, you hold it, you pinch it, and then you kind of do like a scoop and roll, right? It takes practice, a scoop and roll. And then your tip is more rounded and you are compressing those little doggy ears on the end of it so that you can, over a period of time, soften the scar and reduce the swelling that's kind of like causing it. So that's how we can like reshape that quote unquote stump, right? It takes a little practice, but try it out. So instead of, the normal starting covering the nail here, you just move and do it from the side of the finger, right? And you have to make sure that you're not very tight, right? You want to give just a 25% stretch. It's a very light stretch. Why? You always need to understand the why, right? Like, I'm a big person understanding the why, because if you understand the why, you can explain it to your patients better. You want a thin stretch, you want a light stretch because this is compressive in nature. So what happens is, as they move and use their fingers throughout the day, the bandage is going to compress and release, compress and release. So if you make it too tight and then they're compressing, it's even tighter. Imagine muffin topping pants that are 2 sizes too small. That shit don't feel good. So don't do it to their finger. Plus, it's going to hurt them. There's a decrease in circulation, plus it's going to hurt. And then they're not going to tolerate it. And they're going to think, oh, well, this doesn't work. Like, therapy doesn't work. It does work. We just have to tweak what we're doing so that we're not causing harm. So it takes practice. I like to do that. And here's my other thing is that you don't have to wear it all the time. I prefer to start with it, and then I get my patients to not have it on during the day all the time, because I want them to interact with their hands and to use their hand. When you have this on, yes, it's helping with the swelling and it helps with the scar and stuff like that. But what it does is it gets in the way of you being able to move. The finger is already weak as it is, and then you put bandage on it, so then it constricts it, so then it blocks it from moving as well as it could, right? So therapy is about finding that balance of what's going to work for your patients based on what they're coming in with and at the time frame, right? So there's a lot of variability, and this is why being able to critically think through your cases is going to be important, because you have an amputated finger, I have an amputated finger, but that doesn't mean that they're coming in at the same time. They're coming in the same phases, and they're having the same problems. We just need to be able to critically think through, when does someone need what and for how long. So I prefer to get them started on this, but then I want them to wean off of it during the day. And if they have a lot of swelling, wear it at night, because when they wear it at night, it gives them that soft compressive effect during the night while they're sleeping and not really using their hand functionally. So you have to find that balance. All right, let me know if that helps. You can leave me a comment below. If you like videos like this, subscribe and like the video. Share this with a friend of yours. Share this with a patient of yours so they can understand why you're doing what you're doing. All right. Inside of the mentorship program, I'm going to leave the link below. We are talking about hands this month. So if you want to go into more detail in terms of how to evaluate, how to treat, and really critically think through your cases, the mentorship program is the best place to get started with us. All right. I'm going to link all my links below, and I hope to see you on the inside.